The fentanyl crisis has medical professionals reevaluating how they treat patients who are experiencing pain. In some cases, they're trying to avoid using synthetic opioids. All new at 6, Channel 2's Blair Miller is in Washington, D.C. with more insight into how the fentanyl epidemic is changing patient care.
Dr. Peter, please tell me.
Physician assistant Ariana Campbell has worked for years in emergency and addiction medicine, administering fentanyl to treat acute pain, as many hospitals across the country do.
The way we use fentanyl in a medical setting is much different than what you hear outside of a medical setting. And it works really well. So we use small amounts of it. It lasts for a short period of time, and it works really quickly.
Fentanyl is a synthetic opioid about 50 to 100 times more potent than morphine. Medical professionals have safely used it for years to treat patients. But outside hospital walls, the impact of skyrocketing overdose deaths is leading to new thinking, including inside emergency rooms, where life and death decisions are made every single day.
We know we over-prescribed, over-administered opioids for a long period of time.
In 2020, the American Hospital Association established guidelines related to using opioids, saying they increasingly recommend incorporating non-opioid pain management techniques for both acute and chronic pain. We spoke with some in the medical field who say alternative options can range from other types of painkillers to more holistic approaches.
What I tell my patients is I have to be more creative now.
Dr. Fahmi Farah works at a hospital in Texas. She says there needs to be a balance, a conversation between physicians and patients to get the best treatment without contributing to the addiction problem happening on the nation's streets.
We definitely have to have oversight so that it's not overused and we don't create an epidemic of, drug addicts.
For those like Campbell on the front lines of both the ER and addiction.
In a medical setting, under these circumstances, it's safe. And yet I'm also going to have a discussion with them if they go home with a prescribed opioid. I'm only going to give them a little bit.
The focus remains on safety and choices.
And I'm going to give them a lot of alternatives, a lot of other ways that they can treat their pain.
Giving patients a voice in their care. In Washington, Blair Miller, Channel 2 Action News.